question, "How are you today?" may be a great icebreaker, but in the meeting between a patient and a doctor, the patient's symptoms, functions, and quality of life are almost never collected in a systematic way. As a result, 30% of healthcare costs are not spent on activities giving value to patients. If there was a way for patients to register and share comprehensive data on their symptoms with their doctors, this would dramatically improve diagnosis, treatment decisions, and follow-up of their health problems. We are now developing such a system, which will set the stage for patient-centered, value-based, and equal healthcare. We call it Symptoms. Symptoms is founded by Swedish doctors active in academia and healthcare. Today, doctors have unique possibilities to misunderstand patients. We are developing a system whereby patients chart their symptoms, functions, and quality of life using the best scientifically validated health questionnaires. The Symptoms system is accessible to patients as a smartphone application at all hours of the day, because answering the question, "How are you today?" makes the most sense when you actually have the symptom, not at a clinic months later. Symptoms presents the patient's data to doctors in a way that improves understanding of the patient's health priorities. This is key for the shared decision-making. Symptoms thereby provides the basis for patient-centered healthcare, as it empowers patients to lead the patient-doctor meeting and make sure the meeting is about what's important to them. Symptoms also gives the basis for value-based healthcare, in that payers for the first time can compare healthcare providers in terms of the quality of life that they're creating for patients. In addition to setting the stage for patient-centered care and value-based care, Symptoms also provides the basis for equal care. It helps overcome language barriers by professional translations of the health questionnaires to multiple languages. It also allows patients with low health literacy to report their symptoms by use of plain language and simple symbols and interfaces. Symptoms provides continuity of care by putting the patient's reports at center stage and letting different doctors access the same data and follow it over time. Symptoms also promotes healthy living and self-management of care by letting patients monitor their own symptoms over time. Symptoms also provide support for telemedicine. Patients can take their time to register thoroughly and repeatedly, well in advance of a telephone or video meeting with their doctor. This saves time at the actual meeting and at the same time ensures completeness in symptom presentation. In sum, Symptoms has the power to completely change healthcare by providing the basis for patient-centered, value-based, and equal healthcare. So the next time your doctor asks, "How are you today?" show her how you've been the last 50 days. She needs to know. You need her to know.